You're listening to the Opioid Matrix, a journey into the rabbit hole, a Rigaku podcast, hosted by Michael Brown. This is an unfiltered conversation that examines how illicit narcotic trafficking is affecting every aspect of our society, including substance addiction, treatment programs, and law enforcement. Let's unpack the issue together.
I'm Michael Brown, and this is the Opioid Matrix. What does it take to truly overcome substance addiction? Is it spirituality, mental toughness, or maybe even exercise? For most of us, exercising in the form of running a marathon, competing in a CrossFit competition, or just making it to the local gym 3 times a week is sometimes overwhelming task. Extreme fitness events like running 26 miles or more can involve strenuous mental and physical challenges, followed by stumbling across the finish line. Now, if you really want to be extreme, say, for example, cycling across Canada, not once, but twice, would certainly qualify as an extreme challenge for most people. But for my next guest, I think you would agree that the challenge of extreme cycling, combined with his mental and spiritual focus, played a key role in beating his opioid addiction, which was far more demanding than the hundreds of miles he clocked on his bike. I want to welcome to the Matrix, Chris Cull. Chris is a 2-time cross-Canada cyclist, filmmaker, motivational speaker, founder of Inspire by Example, and a recovering opioid user. Chris, welcome to the show.
Thank you for having me. Appreciate it.
Yeah, I love to cycle, but I think you're in a whole nother class than I am. Cross Canada twice, coming out of addiction. Excuse me, that's an incredible story. Can you kind of take us through what led you to cycling and all your mission to inspire by example?
This stretches quite a bit. How it all came to be, I suppose you could say, is when I was in my late teens, my father, he's a paramedic here where I live. I live just outside Toronto, Ontario, and he was diagnosed with Huntington's disease, which is a neurodegenerative disease, and he ended up losing his job, lost his license, started drinking really heavily, and just to cope with everything as he kind of declined. And through that time, he told me he was going to take his own life, and then actually started trying to on a fairly consistent basis. And it got to the point where not only his disease had progressed, but it got so bad where I'd come home in the evening one night on the weekend, and he would think I was an intruder and attack. And that happened multiple times until I had to pin him until he figured it out. And the stress of all that just compiled over. It was about 2 years. Led to, it was like walking a knife's edge of stress for years of my life. And then on March 5th of 2007, on March 4th, he's told that I was going out for brunch with my girlfriend at the time and her family. And he told me he was going to go out. He hadn't been out of the house in a week. So I'm just like, yeah, do your thing. So he went out, came up, gave me a hug, he told me he loved me. And I hugged him, told him I loved him too. I got the habit of that, knowing that I didn't know when he was going to pass, just that he was soon. So I just kind of got into that habit. But he didn't come home that night. And when I woke up the next morning and went to school, I'm like, I was worried. Because weirdly, he didn't come home, but even weirdly, he wasn't home in the morning. Then I'm like, okay, if he's not home after I get home, then this is a problem. So I went to school, did my day, and came back. And he still wasn't there. So he had a couple bars around town that he frequented. And I found out where he was the night before. And logically, he had to stay somewhere. So there's a hotel right in that parking lot of where that is. And so I called the hotel. They told me they couldn't tell me if he checked in, but asked me if there's a reason why he would want to harm himself. And they're like, damn. And it was just, I knew the worst outcome was probably going to be the most likely. So drove over there. And as I was there, paramedics who were actually friends of my dad's, who I had known since I was a kid, had pulled in and ended up finding him in a hotel room, and it just shattered me. I was just so the image is burned in my mind to this day. It's like yesterday, but and I just broke. And So the years leading up to that, and like I got to the point where I got so stressed where I started to use Percocet to just calm myself down. Just because it was the only thing that kind of really brought me back down to a base, like what my baseline was. So I could actually continue moving forward in school and with my relationship and stuff like that. And then that escalated up into using Oxycontin for, that led up to using 80 milligrams, and then that led up to using like 5 80 milligram pills a day, and then it just spiraled out of control. When my dad passed away, I was just kind of getting into the getting into the oxy phase. Then it's just after that, it fell apart. So went on. So I went 2 years, lost everything that meant anything to me. Lost his house, spent 6 figures on pills that he had left me. I lost everything, and ended up figuring out that like I got to do something. My mom lives in Phoenix, Arizona, and so I went down there, and she's a charge nurse was a charge nurse at a hospital in downtown Phoenix, and her husband's a physician assistant. So I figured that they could help me because they're healthcare providers, it didn't go well. Ended up coming back, tried going cold turkey another time, and just wasn't able to pull through. And just thought I was fail. I couldn't. There's nothing I can do about this. And then one of the people I used was telling me about methadone, and I'm like, whatever, I'll try it, because the people who I started using with were starting to use IV means to get high, and I was just like, yeah, I'm not going there. I was already on the I have an issue, but I wasn't gonna make it go to that length. And so I got on methadone, and that was a 5-year journey. It spent so much money that I ended up the latter 2 years of methadone. I went 2 years without gas in my home. So I had no heat or hot water. Canadian winters can get pretty cold. And then I had I was stealing my food to eat. I went down to 139 pounds. I wasn't using any drugs anymore. My methadone doc, the first one he's a bad doctor, but he just, 20% of the time, maybe he was talking about what was going on with me. The rest was talking about what's like a cottage he was rebuilding. But my second doctor was actually awesome. She demonstrated to me that she genuinely cared about my best interest, sat down and kind of had like a heart to heart with me. And that really, that actually stopped me. That I stopped using drugs completely after that. And then I was still on methadone, but stopped everything else. And so she built a rapport and the trust with me. And then so we started actually being able to work together as a team. And then I tried getting off methadone a few times prior, but the thing that really put it over was that I was working my job as a cashier at a Walmart where I live, and you take it all day kind of working there. It's just you. Anyway. So a guy came through with his groceries. I scanned all the stuff through. He had these 3 apples on the end. I put it on the scale, punched in the numbers, told him it was the wrong price. He told me it was the wrong price, and I pulled out the flyer, showed him, told him it was the right price. He went back and grabbed that sign off the produce bin that dangles on, or the sign that you slip the pricing into, the dangle on the bins. And he came back and he frisbeed square into my nose, cut my nose up to say 50 cents on 3 apples, and I properly lost it. And I'm I was already down and out, and now with this, and it was just damn, and then went home and I quit my job that day after the tirade I went on. I knew I was gone anyway, so I sat there for 2 hours staring at a wall unit, figuring out what are you gonna do. And I ended up breaking out this notebook and a pen, and I ended up writing down these. I don't even know what drew me to do it, but I wrote down these 4 boxes with my passions, interests, hobbies, stuff I knew I hated, and then I just kind of started dreaming of to what would I do if I could do anything kind of thing. I'd always had an interest in film, had zero experience in it, and then I'd been an athlete prior to falling into opioids, so I kind of I'd get back into that, and if I was dreaming and could do anything, but it was just this thing that's had such a profound effect on your life. You've seen it all. Spending 5 years at a methadone clinic in a downtown core of an urban city, it's you see a lot. And so I'm really maybe curious as to what everything else was like across Canada. So I ended up making the decision. Like, I'm like, yeah. So I ended up coming to the conclusion, I'm going to ride a bunch across Canada, film a documentary, and without zero experience in any of not having rode a bike in 8 years. So that's kind of what led to all of that. I could go through more, but I don't want to be rambling a while.
No, I think it's important for listeners to understand, to understand where you are now, we need to understand where you came from. But this prescription addiction in America is huge. We've seen so many people slip into more serious substance use, starting off with prescription Percocets and Oxycontins, and then leap into heroin, which led us to this whole fentanyl crisis. But it's this emotional stress, right? I've talked to so many other individuals who came out of a substance addiction like yourself. And it all started with a family issue, something at home happened, whether it was abuse or one parent household or low income, not enough food, a parent being sick, right? You being the only provider, the emotional stress that puts on an individual. And then to have your father, in a suicide situation was just that little bit that pushed you over the edge into those Percocets. I mean, 580 milligrams a day, that's a lot of oxy, was that all prescription or did you buy any from the street? It's all streets. So the accessibility in Canada, is it as easy as the United States, I would assume?
At the time, I got off everything in 2014. I hadn't used anything since about 20. So I'm a little dated on that. But when I was, when you're in opioid addiction, you'll always find it. You'll go to the ends of the earth till you find it, kind of thing. Right. So, accessibility, you have your time for a lot of people have it, yet your ebbs and flows with it. But it was fairly accessible. It's, who to call, you can get anything you want.
So you've been clean since 2014?
Yeah. So it'll be my 10 years in 2 weeks.
Wow, congratulations. You had no recidivism, no fallback in that time?
No.
Wow, that's amazing.
Mental health, it's been an up and down, stuff like that. And at one point, I don't drink alcohol or anything and haven't for years, but there was one point where I thought to myself, I'm like, this is a really slippery slope. And I'm like, I've seen this story before. I know how this ends, and I'm not willing to play with that. So that was the closest I came. It wasn't really part of the stretch.
So then you get on a bike and you decide to ride across Canada, and where does it go from there?
So I took the bus to the library where I lived for about a year and a half as I was tapering off of opioids. Took out every book I could find on everything I wanted to do and use their internet and computer because I didn't have either to reach out to people to figure out how I was going to make this happen. And just, it was a process, but thankfully put it all together. And then I got off methadone on January 27th of 2014, was training all the way through, hopped off methadone. So I started eating regularly again in the November. So I was 140 pounds then. Started training in December. And sold my place my place in January, got off methadone end of January, was on the road riding and filming in May. So
that's amazing.
It was, it was tense. And, the whole thing is it was the first time in my life where I had this thing that I was doing something for me, of something that I genuinely wanted and I believed in it, what I was doing. And anybody could have, couldn't do it. So it was just I just didn't, I was going to do it or time kind of thing. So,
right.
My point in sharing that is it wasn't until I had a vision of what I wanted to do after I was off everything. And that really pulled me towards the recovery rather than me trying to push this boulder up the hill. So that's kind of what led me there. And, so the bike ride was training for that, giving me purpose to punch through everything. And, rode across Canada. I interviewed people. So I rode from Victoria, BC to St. John's, Newfoundland, the first ride. Ballpark, just under 8,000 kilometers, I believe. I went town to town, coast to coast, talking to everybody who would talk to me about what was going on in their community, about the opioid crisis, and filmed at least 60, 70 interviews. Only used a handful because it's a documentary, but it was crazy. It was crazy how much I saw and how much I learned and how many people I interacted with that were kind of impacted by it all. And then a part of it all was going out and doing all this crazy stuff I used to dream of doing that I couldn't do. I couldn't travel when I was on opioids. So I hit golf balls off the Rockies in BC, jumped out of an airplane over Montreal, whitewater raft in Northern Ontario and stuff like that. So, yeah. So, and then, did that across, interviewed everybody who talked to me, and then just raise awareness for this thing that was kind of impacting a lot of people. It continues to get worse. So, then that led to, I did a second ride in 2016, but after my first ride, I mean, I was the only person in the country. So I just told that I went across physically community to community studying this. And that got me an invitation to a couple places in government to go do a presentation. And thankfully, with the health minister at the time, or federal health minister. So that led to some doors opening for me. So what kind of came out of all that was I did some consulting with the health minister's office. I am currently on the board of directors of the Canadian Center on Substance Use and Addiction, policy committee of the Canadian Society of Addiction Medicine, Ontario Health on a bunch of different strategies, CAMH, or the Center for Addiction and Mental Health, and they're working on their constituency council, which is a long story. And then I work locally where I live on the Durham Region Opioid Task Force, and my day job is working within the crisis team on the in the emergency department where I live. So that's one component. And that I just finished filming a series called Surviving Addiction, which is on YouTube. You go at Surviving Addiction Show, it'll come up. And created and inspired by example. And the idea is just sharing it's kind of on the Gandhi quote, be the change you wish to see in the world. And it's highlighting kind of those stories of people who seemingly went to the brink of disruption and came back, are doing great things in the world, and trying to expand that. Like the surviving addiction is a kind of an extension of that. And then there's some stories of recovery stories of recovery on my website, my documentaries on there and everything like that. So.
Yeah, I checked out your documentaries, man. I mean, it's extremely impressive and informational as well. Very informative.
A little dated. It's like a time capsule at this point. Sure. But I mean, but it's interesting to kind of look back and see where things were versus where things are. It's they're night and it's pretty brutal. But
so let's talk about where things are now. So Canada. The drug usage laws are much more liberal than they are in the United States. Decriminalization, personal use amounts. I think BC has, British Columbia has a safe drug supply pilot where people can actually, I believe, get pharmaceutical grade cocaine if they're in treatment. But with all of that harm reduction, I am seeing, or the numbers clearly indicate, that Canada is experiencing an increase in fentanyl related overdoses or poisonings. When you're going across Canada, though, for those two times, what were you seeing as the reason for this rise in drug usage? When you compare it to now, right?
Yeah, I mean, back to your earlier point, I mean, so much of addiction, it might not seem so on the surface, so much addiction is related to some underlying trauma or something that's going on. And that's what, this pulls a lot of people into it. But I mean, as far as the causes, I mean, it was at the time, I mean, the conversation was around overprescribing. I mean, I worked on the Canadian opioid prescribing guidelines for cancer pain right after I did my ride, actually. So it was and then that was a lot of diversion was happening when during those days, which is how I got all my. So it's been the opioid crisis is not black and white. It's very complex. There's a lot of different layers under it. I've learned over the years. But I mean, diversion was at that point. Diversion was was one of the primary things that kind of got the snowball rolling. But then if you go down into like Purdue Pharma and misbranding OxyContin and all that, I mean, it's a rabbit hole. So there's a bunch of factors into it.
No doubt. Purdue Pharma, at least in the United States, was the catalyst which launched America into this over-prescribing, prescription addiction, then leading to more serious narcotics. But then again, focusing on Canada, trauma is not just limited to one race or another. Trauma is a global experience that all human beings go through. But there seems to be a difference now in how we deal with traumatic trauma or just everyday life compared to when I was growing up to now. And I have a lot of parents, a lot of friends of mine who have kids who are on prescription drugs at 5, 6 years old for various issues. Are we in danger, or have we become a culture that's gotten too used to taking a prescription drug for just about everything? I mean, if you watch TV, there's a prescription drug for daily stress. If you're overweight, if you're working too much, if you got a bad relationship, there's a pill for everything. Is this not leading us down a very dangerous path?
Yeah, I mean, I think so much of a person's kind of development is based on their upbringing. I mean, don't get me wrong. With the advent of social media and the internet kind of coming in the 2000s up until now, I mean, people's way of coping with, sorry, how should I phrase this? There's a lot of onset of mental health issues based on kind of the rise of that component of it too. And with the usage of prescribing, I don't want to testy waters there. I think a lot of it is there's one component of it is just the development, the upbringing of the kid. I mean, and how they're developed and how they develop over those fundamental years. And make sure they're loved, they're nurtured, all of these things. And I mean, we do live in quite a culture of easy fixes. We're always looking for the quick way to get things done, and I think that contributes to the way we think rather than take a more holistic approach. But I mean, I think prescription drugs are warranted in certain circumstances. I'm not against it, but I do. It does concern me, the amount of prescribing that does go on, because it particularly with kids during their development, because I mean, the effects of that could be just detrimental to their development. You know what I mean?
Sure.
So I mean, I'm not telling anyone how to be a parent because I'm not a foster myself, but I mean, I try to aim for every avenue of approach before and see until you get to that point. But I don't really have a firm answer on where it's breaking in the culture of things.
I get you, but looking at look at a lot of obviously I'm a little familiar with what's happening in Canada, but definitely what's happening in the United States. And I saw some statistic of data the other day that roughly said 1,800 teenagers in the last couple of years have died from fentanyl, taking a pill which they thought was an Adderall or Percocet. And obviously the cartel, Sinaloa cartel specifically, has dialed in razor sharp focus on this new paradigm of individuals who take prescription drugs or who are addicted to prescription drugs. And that's where we're seeing a large percentage of our fentanyl overdoses occurring with, a teenager who takes half an Adderall. And we just had an interview the other day. I was talking to a mom. Her son took half a Percocet. It was fentanyl, and he died on his 19th birthday. Right. So these are teenagers, young adults who that are not predisposed to dangerous drug usage. Right. These are just average kids who are living an average life, go to a party, take half a pill, 30 minutes later, they're dead. So, and this is outside of the trauma age, right? So we've got trauma issue, then we have just kids being kids. This, like you said, this problem is very complex, and it needs every aspect of it needs a different approach. But what can we as a society do? We have to have a more uniform approach to this, whether it's restricting prescription drugs more, maybe having a panel before we start to prescribe. But definitely something has to be done on the cartel side. We have to limit the ability or degrade the ability of these cartels to distribute these narcotics. And the Sinaloa cartel has set up shop in Canada. There was a case a few months ago where his large fentanyl lab was taken down by, I think it was RCMP, but Sinaloa had set up a fentanyl distribution lab, and then they were sending fentanyl to Australia. So obviously the cartels see Canada as a new emerging market for the distribution of fake prescription pills. And that's going to make your job a lot harder.
Yeah, I mean, it's already pardon my language, a shit sandwich. Yeah, the illicit drugs are absolutely destroying. They're already rampant in our communities. It's not a new thing. Traditionally, things usually start out west first and then kind of slowly go east as far as drug trends. Halifax and Nova Scotia, they're starting to pick up their fentanyl numbers a little bit, but BC being a bit of the epicenter for it. But yeah, no, I mean, I'm not. I think law enforcement needs to do their thing. And I mean, you want to get to the heart of the issue and stuff like that. Like, yeah, there's the enforcement issue 100%, but there's also the prevention issue you need to do with kids. Right. And we need to, I mean, that's really, like, I mean, I go speak at high schools all the time and I try to, I don't try to scare the hell out of them, and it's not going to do anything because I'm the product of that. But, it's just, yeah, no, that has to be a massive component of it is prevention. We can't just rely on harm reduction or anything like that as some single silver bullet, because it's just, that's a fantasy.
Sure. Well, you're a pretty young guy. How are the high school kids, how do they respond to you when you tell them your story, that the trauma, the addiction, the living on the street, eating off the street, does that resonate with these kids today?
Yeah, because I intertwine my mental health within it. So my background kind of is depression, anxiety, PTSD, ADHD, and addiction. So but I teach them I show them how I've made my mental health work for me. But I weave the opioids in there as well to say, this is where that led. But, and I'm real with them. I'm listen, statistically, many of you are going to experiment. Some of you are going to become addicted. And I'm telling you that, if you do, I want to show you it's possible to get it. So there's not this, I actually saw a kid emerge a couple months ago where I work, and I'd spoken at his high school 5 years prior, and we connected that. He was in there for an IV drug infection, or an IV infection from drug use. And we put it together, and I'm okay, well, he knows the background. And so I got the rapport. So I ended up talking to him, and then he dug his problems, and then I got him connected with crisis. And he actually went out to city about 2 hours away, and went to their detox there. And he's doing good now, but I mean, I think it's important. You got to get real people in there telling their stories, but not in the context of trying to scare the hell out of people, but try to show, inspire them and listen, yeah, no, I have all these, I have a complex kind of, concurrent disorders with mental health. And I mean, finding solutions was complex, but I got it down, but it took me time to figure out. I try to show them that like depression, I mean, that helps me become more adaptable because I can reorder my life. Anxiety makes me think like a chess game where I'm 4 or 5 steps ahead. Addiction taught me if I want something bad enough, I'm going to find a way at it, how to make it happen. ADHD is I can actually hyper focus on things I'm interested in, but if you throw something like a math book in front of me, I'm out to lunch. But I mean, so it's just no, I doubled down on what I'm interested in, which led to the cycling and the ride. That's kind of what I saw people quit on the side of the road doing that. I mean, but anyway, and the PTSD is a little more complex managing that one, but it reminds me kind of where I come from, and without knowing with any illusion of where I can go back to. But within that, I layer in how the opioids came into that, and how using that as that band is my way of coping just destroyed my life. It took everything from me, everything that meant anything to me, it took away. And
it's the opioids were the final straw, which brought all those challenges to a tipping point for you.
Yeah, and I showed them a picture of that when I was 139 pounds. I mean, I looked like I was on death's door. I don't know if you've seen maybe The Machinist with Christian Bale, but it was similar. Yeah. It was just it was bad. And there's a picture on my social media of it, but it was, and they're like, no shit. I mean, he's been through some things. So then it gives me the credibility to be able to talk and be free. But I talk to them how I talked in high school. I'm just a dude to them, and that's kind of how I carry myself there. But I mean, you adapt to your audience, right? And you present in a way like the more they can relate to what you're going to say, the more you're going to take away of what you're going to say. So I walk into every speech I do with that kind of attitude of like, what do I know that, and how can I present it that will benefit my audience the most? And I have my tattoos out and a short sleeve shirt. And and then I'm like, I jumped out of an airplane, did all this stuff. And I'm a filmmaker. So that kind of resonates with them a little bit. But once you kind of get them and then you hook them in with like, kind of like, that this is legit. And then you can start planning the ideas and help them kind of find ways to frame the world a little bit differently than that of a high school kid.
You bring up an interesting point, street cred. I've talked to a lot of PhDs, psychologists, sociologists, and doctors who do what you're doing, but they don't have the street cred. And I get the impression when they talk to kids, the message doesn't resonate as well. Do you think we need more people with street creds? I mean, there's a lot of people out there like you who could really, we got them all together, could deliver a powerful message. Because, kids, they're going to look at you and say, well, what do you know about it? You didn't grow up in the inner city. You're not African-American. You didn't have your father die. You got to have something that resonates with kids today where they can relate to you and then they follow, right? Or at least they listen to you.
Yeah. And I mean, that's the thing now. I mean, we live in like a 24-hour news cycle kind of sphere. And I mean, people are numb to statistics. It is what it is. I mean, you could throw numbers at kids. I mean, that's not how you get through to them. That's just not how they process information. And you have to understand that. Like, I mean, think about it. So I would tell anybody, like, think about it when you were a kid. Would you have been receptive if you're like, 6% of, you know what I mean? Like, it's just like, no.
Right.
It's just not how you talk to them. And it's just that you have to be able to adjust how you present, how you package your message to them in order to be effective at what you're doing. Like anything else. I mean, communication is everything in everything. So it's just how you communicate is so critically important. And what you're communicating is even more important.
Now, what about for parents? Because I think if parents play a critical role. But I think parents are missing a lot of the warning signs when their kids are young. And then when they turn 16 to 17, they're like, what happened? And they die from an overdose. Parents are like, we never saw this coming. What are you messaging to parents? Are you telling parents, hey, this is what happened with me. This is what you need to look out for. These are the warning signs you need to look for in your children and get in there early and prevent them getting to, a critical mass point like you did.
Yeah, I mean, I've had a lot of talks with parents. I mean, even on the first ride when I got out to PEI, I got asked just to do a talk specifically for parents. And a good friend and colleague of mine, her name's Angie Hamilton. She runs an organization called Families for Addiction Recovery, which provides peer supports for parents with kids with substance use disorders. But when I go in there, I mean, it's typically when people are messaging me about it is because it's already hit that critical point.
Too late.
Yeah. And I mean, I get messages all the time, like from people I know and their so it's like I don't go around kind of like preaching my message to people, but like chances are if we're encountering each other, like they know where it can go. But like I just try to teach them what brought me to those levels, what were the little nuances and within all that whole equation, and try to at the end of the day, if you're a parent, I mean, you can't it just. The saying goes, don't light yourself on fire to keep other people warm. You have to be able to put that mask on yourself before you put it on someone else. And I'm not going to go into a whole advice thing on parents, but I mean, it's right. It is it is such a critical thing. And I mean, it's just, I've seen parents get to their breaking points. They're just so tired and exhausted of the cycle of addiction, and completely empathize and understand them. I know what it's like to be the family member of somebody with addiction. I also know what it's like to be the person. So, and there's an emotional you're so emotionally hooked on sorry, I should phrase this. You're so more emotionally tied to your family member than you would be somebody else. So it's very hard to be objective about what you're doing with that loved one because you care about them so much that you get frustrated with things where that's typically the right answer. Like, getting mad is human. We all do it. But also being on the receiving end of that anger, as much as it may be warranted at times. It's not, and there is times actually where it is very helpful.
Yeah.
But yeah, and it has its place for sure. But I mean, it's like when my doctor sat down and had that heart, that resonated more in me than any ass I rig off my brother, my mom, or dad, or whoever. So it's, yeah, I mean, there's again, it's all down to communication, how you approach it and what you're approaching it with.
Yeah, that's a good point, is the medical treatment. I know Canada has more socialized medicine. Where does Canada stand in terms of, drug prevention and doctors like your doctor who treat addiction? Is that something that parents and teenagers can easily get, or is that a long process?
I'm sorry, with the
for treatment for drug in Canada, you have like a more social medical system. What I'm trying to say, treatment's available. Basically, is it easy to get drug prevention or drug treatment post-treatment in Canada?
Well, you have private treatment centers up here as well. So, I mean, if you have the money, you can get in anywhere. But that's the problem.
It's the problem.
Is that we have a more bigger and bigger kind of homeless crisis kind of on our hands, and it's just it's not like a treatment on demand if you don't have the means to get it. It's very difficult. You can access like withdrawal management and things like that, and like our RAM clinic, which is rapid access addiction medicine, so that you walk in there and you figure it out, like try to navigate it as quickly as possible. But it's very good. It's just that between COVID and everything that came with that was just that fentanyl, it was just like the holy trinity that just came together, and like we just haven't been able to catch up. It's been absolutely taxing. We're having short staffage in our hospitals just because it's just burnout rate is insane right now.
Yeah, I know. It's funny. We went from COVID, which was devastating, to fentanyl, which was kind of operating in the shadows. And then COVID kind of got pushed back, and then boom, now we're at 100,000 overdose deaths a year. But they say everything that happens in Canada happens in America first. If you're looking at trends in America, it doesn't look very bright for Canada in terms of the spread of cartel fentanyl, the increase in production in Mexico, the reestablishment of criminal organizations from the U.S. to Canada, because they see a bigger, more vulnerable market in terms of prescription drugs, softer drug use policies, harm reduction policies that some would say enable drug addiction in Canada. So, I'm from the law enforcement side, former DEA guy for 32 years. So I'm always looking at the big picture. I don't look at, if we can reduce the amount of fentanyl and unregulated prescription drugs, then perhaps we can start to curb the addiction rates. But of course, that process along has to have the harm reduction process with it to make that work. Are you working with the RCMP, Royal Canadian Mounted Police, or any law enforcement groups along with your messaging?
Law enforcement are certainly at some of the strategic tables that I sit on, but are like we get the updates kind of on the bigger picture, as you said, from like the Ministry of Public Safety through one of my roles, and you get a lay of the land of what's going on the bigger picture across Canada, both on safety and on a law enforcement side. Locally, I work on the opioid task force where I live, where law enforcement is involved. Law enforcement is such a critical component of this, and I know that, to some that's an unpopular opinion, but it's the reality of the situation. Can't do it without it.
No, we've had groups here in the United States that actually advocate for the closing of prisons. I think California actually closed 2 prisons, if I'm not mistaken. Of course, that was followed by a dramatic increase in crime, drug distribution, and everything else that comes along with that situation. So, at least in the United States, we're seeing 2 opposing extreme parties. One is like declare narco groups terrorists, go after them hardcore. And the other group's like empty the prisons out and stop arresting everybody, because we're going to work our way through this somehow. But we've got to find somewhere to meet in the middle, because we can't take another 100,000 overdoses in 2024, at least in the U.S. I'm sure those numbers in Canada will also increase, maybe to not that extent, but certainly we're going to see a rise in the overdose fatality rate. But again, like what you're doing, I think, is at the core of what needs to be done, getting the messaging out, talking to teenagers and young adults, because this prescription pill paradigm, with the internet and everything else, the availability just makes it too easy to get a pill that can kill.
Yes, I mean, at the dark web, there's so many different means that people get their like, used anecdotally from just my interactions with people. It's just, there's so many different, there's so many different ways that people can access it now that it's just like, that wasn't the case like when it was bad during my era. Right. So it's just that things have got progressively worse. They're going to continue to get worse. This whole division thing is getting a little out of hand with two extremes on like the small percentile on the both side. You know what I mean? Of whatever argument, like particularly with opioids. I mean, there's the harm reduction and recovery community, and I see just childish bickering sometimes when it's just like, let's bring the adults in the room. Let's have some conversations here, because at the end of the day, everything, nothing matters if we're not on the same page together. Like, exactly. You may as well just write it off. And like, until we can start agreeing and having difficult discussion, being able to disagree without hating what that person stands for. I mean, it's absolutely absurd at this point, and I see it as such a detriment. And I've noticed that actually to be a very big point of discussion at kind of the national levels, where in Canada, anyways, is how do we rope people back in so we can actually start working and having everybody at the table and being able to kind of have the difficult conversations. And thankfully it's a priority, but it's not big a priority enough. It has to be one of the pillars of our approaches.
I think that's got to be the first pillar that comes down, is break people out of their silos and be able to have a conversation without it degrading into an argument right off the bat, because you're not agreeing with what I'm saying. So if the parents can't agree in the room, then how are we ever going to get to saving our kids? So you make an excellent point. We've got to put our petty differences aside, because we're looking at a very serious problem here in North America. But Chris, what's next for you? And inspired by example, what are you doing for 2024?
Still recovering from 2023. But no, my series is rolling out slowly but surely. The next episode, I believe, comes out at the end of January on YouTube. So what surviving addiction is, it's the different angles in which people experience addiction through and their lived experience. So the first episode is my episode, where I go into pretty deepest detail I've ever went with my story. And then that was my lived experience, how I got in, how I got out, what I do now. The second interview is a physician who I worked with on the opioid task force, actually, and just a gem of a human being. Her lived experience of witnessing this and being the addiction doctor in our emergency department where I currently work. She's since left, but she got the toll it took on her as not just a physician, but as a human being. She hit burnout really hard. Her lived experience from approaching the opioid crisis from her perspective. Then I have a father who lost his daughter to an overdose. A mother whose son, actually the woman I was mentioning earlier, her son's in active fentanyl addiction. Another physician from the University of Toronto, and another girl with lived experience, a woman who's got a pretty remarkable story of kind of resilience and coming back from the worst. So that, and I'm going to kind of start kind of really getting out and speaking a bit more, because it's just, the more urgent this stuff gets, the more motivated I get to do my thing, right, and to go and just like at least just let me get my message to you and like show you at least that kind of. So speaking that, and can continue with my policy work and just trying to how to turn this stuff around, because this is really encompasses my whole life. I'm single, no kids, and it's been like my singular focus for like, it's been like dedicating my life to this for the last 10 years. And,
well, this is I'm sorry.
Yeah. Oh yeah, no, sorry, going on, but yeah.
No, I mean, this is once you get in it, it can become addiction itself. I mean, I retired from DEA, but I was going to take it easy. Next thing I know, I'm doing podcasts talking about addiction, working with people like yourself to get some messaging out there. But I think we've got to get you down here to the U.S. as well and talk to some of these kids, because your lived experience is exactly what a lot of teenagers are going through here in the United States. But Chris, I want to give you the last word. We're just about out of time. Is there an email where parents or teens can reach out to you if they want you to come down and and talk to them as well here in the U.S.?
Yeah, so my website's inspiredbyexample.ca. On social media, like say Instagram, it's at Chris Cull, Cull. It's to get in touch with me. More importantly, though, to anybody out there struggling, going through it right now, or if your loved one is, like, yeah, just don't ever give up that compassion for that loved one, because it's not that, like, say I was a bad person going through what I went through. Like it wasn't that I was some moral failing. It was just that I just didn't know how to handle what was going on. And a lot of people are in that exact same position. The answers are never easy, but I mean, just don't stop. And like, don't light yourself on fire to keep other people warm. I mean, you got to keep yourself together in order to be able to help others. So it's, like I said, it's a complex problem, but I mean, I'm a firm believer if we can put these petty differences and vociferous disagreements aside, I mean, we can really create something special and actually start working as a unit. I mean, it's like Stanley McChrystal, the general, American U.S. Special Operations General. He's like, yeah, to defeat a network, you got to be in order to be that network. We got to be on the same page and talking to each other, and we got to put those silly differences aside in order to do that. So I'm hoping 2024 brings a little bit more of that rather than less.
It sounds like you're quoting The Art of War for Drug Addiction by Sun Tzu. So again, I want to thank Chris Cull, that's Cull, for coming on the Matrix and sharing his lived experience with addiction recovery and success. It's definitely a story that should be told again and again and followed when possible. Chris, I want to thank you again. And the Opioid Matrix is here for you. Let's keep in touch and talk in a couple of months, see where you're at, see what you're seeing in Canada, and see what we can do together to make this world a better place. So again, thank you.
Thank you so much for having me, and keep up the amazing work. I mean, we need more voices, and I mean, it's a unique angle with the enforcement side, kind of specifically honing in on this. And I mean, I applaud you for your efforts, the job you're doing. So that's
thank you, sir.
Thank you.
We're starting a 2-man team right here. We'll just keep building.
Let's do it.
We need to get your doctors on the show too. I'd love to talk to your addiction doctor and see, what's going on in the medical side of this situation.
Yeah, I've tried to get her into some of my stuff, and she's just not in it. She just won't do any public stuff. She just got her. She's just a very private person. But hopefully, nobody can persuade her.
All right, let's stay in touch, brother. And like I said, man, fantastic job. And I want to see you get across Canada again and keep us informed on what you're doing.
Rigaku Analytical Devices is a U.S.-based manufacturer of advanced analytical equipment for the identification of unknown substances. Utilizing Raman in our devices means we can non-destructively scan through packaging with a result of identification in less than 1 minute. Rigaku is committed to supporting and partnering with your agency to tackle this problem together. To learn more, visit rigakuanalytical.com. Thank you for joining host Michael Brown for this episode of the Opioid Matrix, a journey into the rabbit hole, a Rigaku podcast. Keep connected with us by subscribing to the show on your favorite podcast player. If you like what you've heard, please rate the show. No matter the controversy around the illegal drug supply chain, our mission is to save lives. Thanks for listening. Until next time.